Hi guys, still on the Rcgp case cards. This one says, explain a new diagnosis of psoriasis to a 24-year-old male lawyer. Looking at your rash, I'm sure you have psoriasis, which is a skin condition that often starts in your 20s. About 2% of people get it. We don't know exactly what causes it. But in psoriasis, there's a build-up of the top layer of skin as it generates layers faster than they can be shed. This results in raised, flaky patches of thickened skin, which we call plaques. The skin underneath the plaques can be red and inflamed. Psoriasis happens more commonly in smokers, and smoking also causes flare-ups. Other triggers include general infection, certain medications, scratching, and stress. Are you particularly stressed at home or work at the moment? We can control the rash, but psoriasis is a waxing and waning condition, a bit like eczema, so it can come back. We use various creams or greasier ointments, which have to be put on regularly for weeks, months, and possibly even longer. If we can't find a cream that works for you, we could ask a dermatologist to see you. They might suggest ultraviolet light treatment, which is usually done at the hospital. In fact, some people find natural sunlight does the trick. So typically in psoriasis, treatment is use of topical moderate potency or potent topical steroids. You could also use vitamin D analogs like calcipotriol creams. You could use cold tap preparations topically. But usually, typically, if there is more than 10% body surface area involvement, you want to refer that patient to dermatologist for trial of phototherapy like the PUVA or the UVB, phototherapy treatment, or phototherapy rather. There's something I liked somewhere. Where's that? Are you particularly stressed at home or at work at the moment? And they say other triggers include general infection, especially streptococcal throat infection can trigger a gutted psoriasis. It's worth knowing if a patient has gutted psoriasis, especially, you need to find out if they've had a current or recent throat infection. The next Rcgp case card goes thus. Explain chronic kidney disease to a 64-year-old man who has recently had an EGFR of 55 on routine bloods. Thanks for coming back after your blood test. The kidney function test is lower than I had expected, but it is not unduly worrying. It certainly doesn't mean your kidneys are about to pack up. The main function of the kidney is to filter the blood and get rid of waste as urine. As we get older, the kidneys work more slowly, and this is perfectly normal. Your blood results suggest that they may be slowing a bit sooner than we would expect. We need to make sure there's no underlying reason for these. So what does it mean? Well, at this stage, it's difficult to say, as one measurement doesn't tell us enough. So we would like to get a urine test and 2 other blood measurements over the next 3 months. I would like you to cut out meat in the 12 hours before each blood test. Otherwise, this can affect the results, suggesting worse kidney function than you actually have. Because creatinine, when you eat meat, there's something on my eyelid, yes. When you eat meat, close to your UNEs, blood tests, you could have falsely raised creatinine levels. And the higher the creatinine level is, of course, the lower the calculated eGFR, the estimated GFR would be. When the kidneys don't function so well, the term chronic kidney disease or CKD is used. In most people with CKD, it's mild and doesn't necessarily get any worse, but we usually keep an eye on it with blood tests from time to time. It's also important to monitor your blood pressure and cholesterol levels. If necessary, there are a number of treatments, such as a particular type of blood pressure medication and cholesterol lowering tablets, that will help to preserve and even improve your kidney function. As long as your blood test doesn't change significantly in the near future, you won't need any further treatment. So let's wait and see what the next blood tests show. Of course, you want to place them on antiplatelets like aspirin or clopidogrel, and also start them on statins, because renal artery atheromas can actually worsen, CKD. So you want to reduce that overall risk. You also want to consider things like the annual flu vaccine and the one-off pneumococcal vaccination as well. Let's go to the third one. This one says, explain what CBT involves to a patient. Throughout life, we all develop ways of thinking, feeling, and reacting to situations. There are lots of influences on these, including the temperament you are born with and your parents' views on life. Later on, your friends and teachers can also have a large impact. Sometimes, for one reason or another, people can get stuck in unhelpful routes or spirals in the way they think or feel, either generally or about one particular issue. The way in which we think impacts how we behave or act. Thoughts and feelings are often called cognitions. Hence, CBT stands for Cognitive Behavioral Therapy. It is aimed at challenging the way you think about certain issues, relationships, or yourself, and in turn, it challenges the way you behave. It is an active process, so it's important that you are committed to it. Sometimes, you will be set homework and may be asked to go away and think about things and write your thoughts down. Each session lasts about an hour, and you can expect to have between 10 and 15 sessions. The next Rcgp case card, this one says, explain testicular self-examination to a 20-year-old man. It's important to get to know your own testicles, because testicular cancer is mostly a young man's disease and can be successfully treated. The earlier the better. To start with, it's important for you to be relaxed and warm. So most men examine themselves after a bath or shower. Stand up and feel one testicle at a time between finger and thumb, feeling for lumps, bumps, and differences. Behind each testicle, there's a sperm tube called the epididymis. This area will feel like a soft rope and can be quite tender. It's normal for one testicle to hang lower than the other, and often one feels slightly bigger than the other. Examine yourself monthly to know what feels normal for you, and come to see us if you find anything you're worried about. So examine yourself monthly to know what feels normal for you. Okay, and then if you notice that things have changed, you come and see us. The fifth RCGP case card for this session says, explain blepharitis to a 35-year-old woman with typical symptoms. You have something called blepharitis, which means swelling of the eyelids. Although it usually only affects the margins of the eyelids. It is not normally serious, but can be quite uncomfortable. Unfortunately, it is often something that stays around or comes and goes. There are 3 things which can cause these. Infection with bacteria, normally found on the skin. Skin conditions such as eczema, or failure of the oil-making glands in the eyelids to work properly. Sometimes people need antibiotics, but eyelid hygiene alone will normally sort it. Eyelid hygiene is a 3-step process. Applying warmth, like a warm flannel, for 5 to 10 minutes helps the oil in the eyelid glands get moving. Next, you need to massage your eyelids in the direction from the nose to the outer side. Make sure it is firm but gentle and only with your fingertips. After this, clean the eyelids with a very dilute solution of baby shampoo on cotton wool. In particular, trying to clean off crusts along the eyelid edge. I'll give you a leaflet with these instructions so you don't need to remember it all. Try to do this routine at least twice a day until symptoms settle, and then once a day to keep them at bay. So the first thing, you place your warm flannel for 5 to 10 minutes, then you begin to rub from the nose outwards, gentle but firm, as though you're trying to milk things away. Okay, so you do that, and after that you use a wet baby shampoo on cotton wool to clean off anything that is at the margin of the eyelid. So you explain that to the patient. So that's number 5. We could do, let's do one more in this session. This one says, explain the diagnosis of chronic fatigue syndrome to a 23-year-old man whose investigations for fatigue have come back entirely normal. Your blood results have come back entirely normal, which is reassuring. But you might be frustrated because it doesn't give us an answer to explain your symptoms. One of the things I thought might be worth exploring was something called chronic fatigue syndrome, or CFS, sometimes called ME, myalgic encephalopathy, yeah? Have you heard about it before? The main symptom of chronic fatigue syndrome is fatigue. To such an extent, it stops you doing things you need or want to do. There are other symptoms that go along with it, such as headaches, muscle aches, and digestive problems, as well as problems with concentration and memory. Annoyingly, it is one of those conditions where doctors can't say why someone has it or what is causing it. And it is often a diagnosis made after we have ruled out other things which we can test for. Usually, I'll give you a handout and ask them to go away. Usually, I'll give people a handout and ask them to go away and have a read of it. Chat about this with people they trust, and then come back and let me know whether they think it is a possibility or if I'm backing up the wrong 3. There are things we can do to help the symptoms, but you may prefer to be referred to a specialist clinic where they can assess, they can where they have access to physiotherapy and something called cognitive behavioral therapy. These have been shown to be the two most helpful treatments in chronic fatigue syndrome, so physiotherapy and CBT. Most people will improve over time. There is hope in the future, but I'm afraid nothing will change overnight. So chronic fatigue syndrome, which is a medically unexplained symptom, extreme fatigue, and some other, malaise, headache, tiredness, just feeling run down, and then all the blood tests have been done, nothing has been found. Okay. Physiotherapy, CBT. Cheers.